Thank you so much for joining us today for the Cancer Now What podcast. I am Jenny, and I'm so excited to be joined today by three very special guests. Dr. Jeff Weber, who is the chairman of the board for Phoenix Cancer Support Network, Dr. Stephen Sckolnik, who is a radiation oncologist with Arizona Center for CancerCare, Megan Rogalski, whose husband Casey is being remembered and honored at PCSN's upcoming Friendraiser Gala. So many of you know me as the host of the Cancer Now What podcast, but I wear many different hats in my life. I am the director of business development for Arizona Center for CancerCare. I am a wife. I am a mother of 3 children. And I also volunteer as the founder and CEO of an organization called Phoenix Cancer Support Network. And Phoenix Cancer Support Network is sponsored by Arizona Center for CancerCare. And we have our upcoming gala on August 28th. So we have 2 people that we are honoring this year at the gala. Dr. Stephen Sckolnik, who is a radiation oncologist with Arizona Center for CancerCare, and Megan Rogalski. Her husband Casey is being honored as honored and remembered friend and cancer warrior. We also have Dr. Jeffrey Weber here, who happens to also be my dad and the chairman of the board for Phoenix Cancer Support Network. So I wanted to start with Dr. Weber. Dad, what is Phoenix Cancer Support Network, and what does it mean to you to serve as chairman of the board?
Phoenix Cancer Support Network is an organization that is attempting and succeeding after 5 years to fill the gaps that occur in cancer care and cancer treatment. People oftentimes, and I know this from my own experience, having had a daughter that got cancer in her early 20s, and unfortunately she didn't survive, but the journey was difficult. Even for myself as a physician, it was still very, very difficult because you don't know what to do, you don't know where to go, who to talk to. I had connections in the medical community, but not in the community at large that were helpful to me. And frankly, there wasn't a lot that was out there 20 years ago to assist people who were going down that trail in the difficult cancer journey. My talented daughter, about 5.5, 6 years ago, came up with an idea that perhaps we as people who have been through this would be able to find a way to help people, to catch them, to provide a safety net, to help them with things like housekeeping, to help them with childcare, to help them with grocery shopping, to help them with anything that they could possibly need. We've walked dogs, we've cleaned swimming pools, you name it, we are there to help these cancer patients.
What does it mean to you to serve as chairman of the board for Phoenix Cancer Support Network?
It feels very good. It fills a huge void in my life. When you lose a child, especially to a disease like cancer after a 4-year battle, you feel as if you've lost a major part of your body. And we tried to fill the void earlier on. We spent a lot of time creating and participating in support groups for people who had lost adult children to cancer. There was nothing for that. People don't think of cancer as affecting young adults, but it does. And we did that. And after a while, you begin to burn out on that, burn out on fundraising. And when this opportunity came up, Jenny so beautifully came up with this idea and asked me if I'd be chairman of the board, I jumped right in. I want to do whatever I can to give back. I feel that Annie is watching, and I don't want to let her down or let other people down with cancer. I felt so much so that I dedicated the next 10 years of my life to treating cancer patients. And this fit beautifully into my purpose, which I think became apparent that I was going to help people with cancer any way I could.
Definitely. And I'm so blessed to have had in a parent, in a father, someone who is a physician who treated cancer patients, who went through it, has gone through it with so many patients as a doctor, gone through it with me as family, seen the whole spectrum of what it's like to go through a cancer journey. And the fact that you bring that perspective as chairman of the board has been so impactful in the way that we've been able to help people. So thank you so much for that.
My pleasure. It also is helpful to have someone with a little more experience under their belt in terms of life experience, which I think I bring to PCSN, which primarily is young people who are working together to help people with cancer. And I love the dedication of these young people, and working with them has been so fulfilling for me.
You saying you're the old man on the team?
I am the experienced one.
The experienced, the wise one.
Yes.
For
yes.
sure.
Uh-huh.
Good. Well, we love having you. So, Megan, your husband, Casey, who we lost in January, is being honored this year as PCSN's Courage Award recipient. Casey was one of those clients that come to you, and I say the word client, but no one gets paid. We just help people for free. I'm a volunteer. We're all volunteers. But Casey and Megan, you came to me actually 2 years ago this month at the third annual fundraiser gala, and you haven't gotten rid of me since. So why don't you tell us a little bit about your experience with cancer and how PCSN fit into that?
Sure. I think the day that Casey was diagnosed, June 14th, 2019, we felt lost. And I am so thankful for coworkers that knew about this resource, this organization, and pointed me in the right direction, because I felt relief the minute I talked to you on the phone, and knew that we would have help, and didn't really know what it looked like yet, but I felt immediate relief that there was an organization out there to guide us through or just help us with daily needs. So,
well, it was our honor to serve you, and we are so grateful to have the opportunity to honor Casey and your beautiful family this year at the gala. So,
thank you so much.
August 28th, Chateau Lux. We're really excited. Chateau Lux is an amazing sponsor who is donating their venue, their time, the food, all of it. So again, we just can't do this without people in the community helping us. And other people in the community that are helping us, that we partner with all the time, are physicians like Dr. Steven Sckolnik. Dr. Sckolnik is with Arizona Center for CancerCare, and he is a radiation oncologist. Dr. Sckolnik, you were one of Casey's physicians, and you're being honored with PCSN's Outstanding Oncology Service Award this year. So congratulations on that. What drew you to CancerCare in the first place, Dr. Sckolnik?
I think most oncologists would say the same thing, that cancer care, more so than any other kind of medical care that we deliver, allows us to kind of have a long-lasting impact on patients' lives. And we always think about how we can touch patients, but on the flip side, patients just as much touch us. And I remember every single patient I've ever treated, and there's some that stick in your mind and your heart more than others. But I think having these long experiences, whether it's curing somebody of an early stage cancer or shepherding somebody to the end of life for an advanced cancer, they're each rewarding in different ways. So, I sometimes tell new people that I meet, they ask, what do you do? And I say, I'm an oncologist. And they say, I'm so sorry, that must be so hard. And I say, it's actually the opposite. It's the most uplifting and beautiful way that you can help somebody. So that's the short version of why I'm here.
So I'm going to put you on the spot. You said you remember every patient. Can you tell us about meeting Megan and Casey?
I can remember Casey talking a lot about racing and really hearing about what his passions are, and his enthusiasm for what his profession was more. It was more than just a job to him. And I remember we would some days, one day when the treatment machine was running late, and he was just sitting in the waiting area, And I just sat back there with him, and it had been a long day for me. And, I'm sure it had been a long day for him too. And he just, told me all about racing and what his job was like and how that was not just a job, but that was a passion for him too. And those are those kind of things where people open up to you. And, at that point, they're no longer strangers. They're part of your lives and you're part of theirs. And, I know that I could see Megan at the grocery store 10 years from now and we would recognize each other and, we'd always have this common bond. So even though, she lost somebody important in her life, it does feel like the same thing for all of your doctors too, because we loved Casey and, all of our patients are so meaningful to us. But we hope that we at least left a little imprint on him and helped his passage be more calm and help your family in the same way.
That's so wonderful to hear, because having worked in oncology, and Dad, I know that you, in your 40-year career as a gastroenterologist, can attest to this as well. You don't always find physicians that actually they have both the clinical expertise and the compassion that you just demonstrated in telling that story. So I can't reiterate enough how important it is to people and families, and when they're being treated for cancer, that they get that from their doctors. We hear it all the time. So thank you so much for acknowledging that. And I know firsthand that all the physicians at Arizona Center for Cancer Care think that way and feel that way about their patients. And it's really something that this community is lucky to have. So thank you.
Absolutely.
So Casey had colon cancer. So I want to understand how Casey's battle was different or the same as other colon cancer patients.
Yeah.
And what did the treatment look like for Casey that might be different for someone else? And then, Dr. Weber, Dad, how do we get in front of that so, another 39-year-old man with 2 children and a beautiful young wife don't have to suffer Casey's fate? So I'll start with Dr. Skoltnick.
Well, I think the biggest thing that we're learning more and more, especially with people like Casey, is that this is no longer a disease of people aged 50 and over. And I think that's going to be a huge change in how we manage these patients going forward in the future, is that it shouldn't just be patients over 50 or over 45 having screening colonoscopies. Now, we don't know, looking back, if Casey had, for whatever reason, had a colonoscopy or some other study done sooner, if that would have changed his outcome. But we do know that more and more, especially men, are being diagnosed in this younger age group. And I think a big part of what we're trying to do is understand who this population of patients is that is at higher risk for this. And as we learn more about how things like diet and family and inherited genetics affect this, we're going to be able to kind of tailor, curate these treatments more closely to these people and hopefully identify them sooner and treat them at a stage where their cancer is curable. So I think that that's really the biggest change, is understanding of this is no longer a disease of the elderly, but it actually afflicts younger people at a much higher rate.
Dr. Weber, any additional comments to that?
Yeah, I think it's very difficult to convince people to take what happens to their body when they're young seriously. And it's been a campaign of mine for my whole life, and especially since Annie passed, that if you have someone in their late teens, early 20s, early 30s, if they have a problem, a change in bowel habit, abdominal pain, unexplained weight loss, loss of appetite, anything that lasts more than a week or two, you've got to push. You've got to be your own advocate. You've got to go out there and you've got to find someone who's going to listen, because no one will do it for you. And the inclination, and it still exists in medicine, is, well, don't worry about it. You're young. You're going to be fine. And because, in fact, yes, when you look at the statistics, likely you will be, but that doesn't come down to the individual case. So if something happens in your life and your health changes, pay attention to it. It's going to pay off in the end. You'll either get a clean bill of health, or something that could kill you will be found in time. But don't wait for years and years and years, or months and months and months. Like I said, if you have something that's changed and that's troublesome, that lasts more than a week or two, get on it and push.
That's great advice from both of you. Thank you so much. So I remember, and, Megan, you mentioned that, I was there with you for a lot of Casey's appointments. Phoenix Cancer Support Network does offer that kind of support where we'll send somebody with the family who's experienced in cancer care and been through the journey, right, and can write down all the questions. I remember one thing that we talked about a lot with Dr. Sckolnik when we were meeting with him was pain management. He had a lot of pain due to where the tumors were popping up in his body, and Dr. Sckolnik was able to treat that with radiation. So can you speak a little bit to how you use radiation for symptom management in cancer patients?
Yeah, absolutely. I think what our role in cancer care has really evolved, and it's gone from just purely trying to treat and cure the patient to recognizing that we could palliate symptoms like pain that have a huge effect on quality of life. And how our treatment has evolved is treatments that we used to deliver over 6 or 7 weeks, we could now deliver over 5 days or even 1 day in some circumstances. So I think a big part of that is us enrolling patients on clinical trials, gaining the understanding of how the medicine works and how we could more effectively deliver it, and then the treatment technology itself advancing to the point where now every radiation machine has 10,000 moving parts, and it's a highly complex piece of technology, but it allows us to safely and more effectively deliver treatment that can relieve things like pain or obstruction.
Great. So you said a trigger word for me, palliate. Palliate and hospice are two very triggering words in the cancer community, and patients get very nervous, and doctors get very nervous when they have to say those things to patients. I want to ask you about, and Dr. Weber as well, palliative care. It's my understanding that palliative care does not mean end-of-life care. It means symptom management, symptom control. And I think that that's really important for people to understand from a clinical standpoint. Can you explain the difference between palliative care and end-of-life care?
Yeah, absolutely. I think palliative care in its purest form is focused on quality of life, and hospice care is focused on end of life. So there's a lot of things that go into day-to-day quality of life, whether it's pain control, whether it's nutrition, whether it's physical supportive devices. So a lot of things that you might say, well, those might seem obvious. When you combine them all together as a package, they can really enhance somebody's day-to-day to the point where they're no longer bedbound, but they're able to get up or experience things or do things with their family. So I think there's a very, very clear distinction that was not so obvious in the past, and now oncology providers, cancer providers are recognizing what the benefit of early intervention with palliative care can be for really any patient who has either a cancer that is a stage 4 or even an earlier stage cancer. I have many patients with breast cancer who we treat, and they see palliative care support services as well, because it's not just the physical, but it's the emotional and the mental component that we have to treat as a whole.
Absolutely. Dr. Weber, anything to add to that?
Yes, back 15, 20 years ago, palliative care did not carry the connotation it does today. This has evolved over that time period. I remember shortly after my daughter was diagnosed, my wife and I were in the room with her, and in walks 3 or 4 people and they came in and said, "We're the palliative care unit here at the hospital." And they talked to us as if she had already accepted that she was fated to die. They talked to us as if their job was to make it easier for her to pass. And they even said to my wife and I, she doesn't need to have treatment if she doesn't want it. She's 18 years old. She can make her own decision. Well, needless to say, my wife Nancy threw that person out of the room immediately, and I don't think that. I'm sure she hasn't recovered yet. This woman that came into our room, but as in the treatment of cancer patients from a GI standpoint, a gastroenterology standpoint, I became a palliative physician. And almost everything that I did was to alleviate some sort of problem, just as Dr. Sckolnik. Someone would come in with jaundice. I would do a procedure called an ERCP and put a stent in the bile ducts and relieve the blockage that was caused by tumors. And the jaundice would go away, their appetite would come back, and they'd be great. They'd start feeling normal again. So palliative care means so much more than it did before. I think there's a place in palliative care for every specialty of medicine. And I think that it's only through cooperation between all the specialties that we can give people the kind of care that they deserve.
Absolutely. That's a great point. And that's one thing also about Arizona Center for Cancer Care. And I know, Megan, you experienced this with Virginia G. Piper CancerCare Network. You know, what were those words like for you, though, when you heard them? Is it was what Dr. Weber and Dr. Skolnick saying resonating with you? And was it helpful to understand the difference between palliative care and hospice care?
I didn't know the difference. I don't think I did back then. And when I heard the word hospice, finally, it was really hard to hear, heart-wrenching, kind of hit me like a ton of bricks.
For sure.
So it's very helpful to hear the difference between palliative and hospice, and how patients and families can get support and managing those symptoms and increasing their quality of life while they're fighting and moving forward with treatment. So,
do you think that it's important, or why do you, I know you think it's important, we've talked about this, but why do you think it's important for the primary care physician to know about organizations like Phoenix Cancer Support Network?
It's a big diagnosis and a lot for myself and Casey to manage, and I can't even imagine, for other families that, may not have as big a support system as we did. We had some family around and friends, but a lot of people don't have very many support systems or resources. And I think it's so important for doctors to know about PCSN, to guide them through their treatment and course of fighting this disease. And I think it's a really dark place in the beginning, and PCSN helps take the weight off of things like going through medical bills. That was a lot. And PCSN and Jenny, you sat down with us and you kind of delegated this one, now this one, and this is what we're going to do next. And that really helped us and Casey take the weight off so that we can focus on Casey and his treatment and, staying positive and moving forward with his care.
I'm so glad to hear you say that, because that is exactly what the mission of Phoenix Cancer Support Network is to take the burden off of people so that they can focus on what's important, and that's getting through this journey. And again, it's so important for people to understand that we don't take payment for this. It's 100% free to anybody who needs help. Everybody who works here is a volunteer. We all have full-time jobs, so it's really, really important for you to know that we call them clients, but we do that out of respect, because we're not healthcare professionals. We're guides, and they are their clients, our clients. So the only way that we make this happen is by fundraising, and that's why we have this big event coming up at the end of August. So I'd like to thank you all so much for being here, for spending time talking about this. August 28th, Chateau Lux. Thank you to Chateau Lux. Thank you to Arizona Center for Cancer Care. Thank you to Virginia G. Piper CancerCare Network for being sponsors of the event. If you would like more information about the nonprofit or the event, you can go to pcsnetwork.org. If you would like more information about Dr. Sckolnik and Arizona Center for Cancer Care, you can go to AZCCC.com, or you can reach out to Phoenix Cancer Support Network, and we're happy to connect you with the amazing physicians in that practice. Thank you so much, and we'll see you next time.